Thank you for tuning in. It is Saturday the 2nd of May. Now this is going to be a difficult video to make. I've actually been making videos, educational videos, since the 1990s, and this could be the hardest and the most important. Now I have been looking at this pandemic now for some time, and back in January, and certainly by early February, I was calling this a pandemic, while the World Health Organization was refusing to do so. And it's not because I'm particularly clever. I just took things that are in the public domain. I took the transmission characteristics of the virus. I looked at what was not being done in terms of social isolation. And it was just obvious it was going to spread because people were flying in and out of China. It was inevitable. Nothing very clever. And unfortunately, there's other predictions to look at today. And again, these are based on things that are completely in the public domain. And the picture is not very encouraging for many parts of the world, to put it mildly. Now, what we have here, we've seen this many times, this graph. So it's from the World in Data, total confirmed COVID-19 deaths. So this is the confirmed deaths. And this is for the world, So we start off here in January and we go up here to the 1st of May as of yesterday. Now what we see is that this line here started off fairly low, but then it gradually picked up with increasing global cases. So that has been the line of increase so far. Not good. Well over 200,000 deaths already. Now this picture here, I've now turned into that picture there on the bottom. So the red line I've just drawn, here is that line there like that. That's what I've just drawn. Now, unfortunately, over the next few weeks, and I'm going to give you data that supports this over the next month or so, what could happen is globally, the number of deaths could easily do this. And the estimate is they could go up from about 1.7 million to well over 3 million deaths potentially. So remember, that little bit there is where we're at now. That square is that whole graph there. So that's the potential level of increase we're looking at in global cases. Now, I have been accused of scaremongering many times. But unfortunately, a lot of the predictions have turned out to be correct. I really hope I'm wrong on this one. But let's just have a look at some of the evidence where this is coming from. So we're on Saturday the 2nd of May. Now, the International Rescue Committee, headed by David Miliband, is a major international non-governmental organisation doing incredible humanitarian work around the world. And don't take my word for it. I always post the links, check the links. International Rescue Committee. The world risks up to 1 billion cases and 3.2 million deaths from COVID-19 across fragile countries. 500 million and 1 billion infections. So between 500 million and 1 billion infections. This is talking about the next few weeks, the next month or two, leading to between 1.7 and 3.2 million deaths. And they're looking at 34 conflict-affected and fragile countries. So what they're saying is there could be that many deaths in these top 34 fragile countries. So that means the graph could end up looking like this. That's the 1 million mark there. That's the 2 million mark there. Now, they do say there's a small window of opportunity left to mitigate and greatly reduce this. But we know we're dealing with a very transmissible virus. We know how it spread in the past. That's how it will continue spreading in the future. And we know that the immune system of human beings has never seen this virus before. And people react to it very differently. But it's a novel virus, so people have no immunity. So that means the whole world population is essentially vulnerable to this virus. But the International Rescue Committee is saying we have a small window of time left to dramatically intervene in poorer and fragile countries. Now, the estimates, these numbers that the International Rescue Committee epidemiologists are making, are based on Chinese data. Now, we know there's difficulty with the reliability of Chinese data, but we know quite a lot about the amount of deaths there have been in China, albeit perhaps underestimated. But say what we like about China and the reliability or otherwise of their data, they actually have a fairly sophisticated healthcare system. So in Wuhan, when the hospitals were having difficulty, they flew in 50,000 medical personnel into Wuhan. They just flew in 50,000 medical personnel. They have a sophisticated healthcare system, and that greatly reduced the case fatality rate. Without those 50,000 medics flying into Wuhan, many more people would have died. No question about that. They saved innumerable lives. But they have an advanced healthcare system. But many countries around the world do not. So Venezuela, for example, I can't remember the figure, but I think about 50% or was it 90% of the nation's doctors have left. They've got tremendous difficulties, and the health service is in, I think 50% of the nation's doctors have left, and 90% of hospitals are critically short of equipment and supplies. So they've got half the doctors they used to have, and 90% of the hospitals are really struggling. So how are they going to cope with an influx? Not easily is one answer. And then IRC, the International Rescue Committee, is also flagging up refugee situations, Syria, Greece, Bangladesh. They mention, but we could also mention other ones such as Kenya, South Sudan, different refugee situations around the world. Now, they point out that the population density in they name three camps in Syria, Greece and Bangladesh. Cox's Bazar, of course, in Bangladesh for the many Rohingya refugees. They point out that the population in these refugee camps is 8.5 times higher than on the Diamond Princess. Now, you probably remember the Diamond Princess is this cruise liner that was quarantined in Yokohama in Japan, and well over 700 people on the ship contracted coronavirus on the ship. But that ship is in a luxurious setting. Everyone had hand washing facilities in their cabin. There are question marks about the circulation of air and the circulation of the virus transmitted by the crew. But everyone had washing facilities, and everyone was isolated in their own cabin, apart from the air being transmitted and the food being delivered. But in these camps, the population density works out as being 8.5 times higher than in the Diamond Princess. Now, in the Diamond Princess, the transmission of the virus was up to 4 times faster than in Wuhan. So in the crowded conditions on the ship, the virus spread 4 times faster than in Wuhan, in an ordinary city. Yet in these refugee camps, the population density is 8.5 times higher than the Diamond Princess. So we're dealing about people in a very small area. That means once there's some community transmission in there, community spread is going to be rapid. Add to that limited access to water, sanitation and hygiene found in displacement camps. The disease will spread fast and could devastate communities. Now, it's not just displacement camps. I've done some work in different slum situations around the world, and in many areas people are living in very difficult conditions, very close together, very limited hygiene, often infested with rats and other unpleasant things. And families often live 2 or 3, even 4 generations of a family in the same room, very limited accommodation. So it's these displacement situations, but in many desperately poor situations around the world as well. So this is not limited to displacement situations by any means. Now, IRC highlight these fragile countries. There's others that they highlighted. How many did they highlight? They highlighted 34 countries for this data. But Yemen, of course, has been at war for, is it 5 years now? Appalling situation. Somalia has had many wars. South Sudan, of course, is a new country. Great hopes for that initially, but it's gone tragically wrong. Again, must be decades of war now with North Sudan and other fighters infighting. Syria, of course, devastated by war. Democratic Republic of Congo, Central African Republic, Chad, Sudan, Afghanistan, Zimbabwe, Guinea, Haiti, Iraq and Nigeria are just some examples that have been highlighted there as fragile states. So a lot of people at massive risk here for many reasons. Now, the International Rescue Committee have been taking data with Imperial College London as well. And this is the Imperial College London modelling. And again, don't take my word for it. Read the full report. It's all there. This is their report 12, the global impact of COVID-19 and strategies for mitigation and suppression. Now, if there's no interventions, if the world just ignored this pandemic, the Imperial College modellers estimate there would be 7 billion infections. In other words, about 80. How many people in the world now? About 8 billion. So the vast majority of the world's population, 80% or more, would be infected with COVID-19. And without mitigation, that would result in 40 million global deaths this year. So this is why we have these mitigation strategies that have been expensive but so effective in many Western countries. So what needs done? Mitigation strategies. Well, they've estimated that if we could shield the elderly, so we reduced their social interactions by 60%. So reducing social interactions in the elderly by 60%. This would slow but not stop transmission. It would just slow it down. The transmission seems inevitable, but we need to slow it down. And if there's a 40% reduction in social contacts for the wider population, and of course many of us have been doing that, that would save 20 million lives. So just reducing the elderly's interactions by 60% and reducing the interactions of younger people and the general population by 40%, that death rate could go down from 40 million to 20 million. Even in this scenario, all healthcare systems would be quickly overwhelmed. Now, what this means is, without mitigation, all healthcare systems in the most advanced country, all healthcare systems without mitigation would have been overwhelmed. So it's a lot of people are struggling with the lockdowns that we have at the moment. But without mitigation strategies, a lot more people would die until we get very comprehensive testing, tracking, tracing, isolating, and ultimately vaccination. So if we hadn't mitigated in the UK, our health system would have been overwhelmed. This is what these modelers are saying. The health systems would have been overwhelmed without the mitigation in the UK or France or Germany or wherever it is. The healthcare system would have been overwhelmed. The reason they haven't been is because we've taken these mitigation strategies. In a typical low, and I can't remember the precise figure, it's sometimes like times 7 or times 9, we would have been overwhelmed. So in other words, there'd be 9 people, 7, 8 or 9 people trying to get into hospital for every available space. And then that's in advanced countries. In a typical lower income setting country, that would be 25, a factor of 25. In other words, 25 people will be trying to get into each hospital bed. That means 24 wouldn't. That means that their chances of dying would be significantly increased. Now, if we hadn't mitigated in the UK, and you'll see why I'm going on about this in a minute, in the UK and the US, the R0 would have been carried on about 2.4 to 3.3. So that means every infected person on average would have infected 3 other people. And each of those would have infected 3 other people. And of course, each of those would have infected 3 other people. And we can see the exponential growth there that would bring about. And if we had taken no mitigation strategies, the doubling time for infections would have doubled every 3 days. So without mitigation strategies, doubling time would have been 3 days. And in the UK, that would have caused just under 500,000 deaths without mitigation. And in the US, that would have caused over 2 million deaths without mitigation. So that's what would have happened without the strategies that are being taken. Now, the strategies that were being taken now are just interim strategies. We need massively more testing. We need to test, diagnose every case. We need to isolate every case. We need to quarantine the contacts of every case. So we're doing this much more targetedly, much more specifically, while we wait and hope for a vaccine. So to get out of lockdown in advanced countries, that's what we need to do. And that is starting to happen, which is good. Massively more testing being ramped up, more targeted testing. It's not just the testing, as we said yesterday, it's the way the testing is targeted and the way that the testing is combined with the tracing, tracking, treating, isolating, quarantine. We need this joined up strategy, which they did so well, for example, in Taiwan and in South Korea. Now, why am I going on about this appalling situation that could have happened? Well, the reason is that we've implemented these mitigation strategies, but in many lower income countries, it's going to be very difficult to instigate these strategies. And in refugee situations and slum situations, it's going to be very difficult to instigate these strategies. That's why we need to take these numbers, that number of 40 million deaths, as a warning to ensure that does not happen, because these numbers are unimaginable, completely unimaginable. Now, thinking about lower income countries, they've got quite a lot of, they've got some things going for them and some things going against them. Now, the thing about lower income countries is a lot of the older people have already died. So overall, they have a lower age group demographic. The average age of the populations are much younger. Now, of course, that's an appalling indictment on everyone, I guess, because it means that they're people that should now be enjoying older life are dead, because they have a very much younger profile population. But we know that COVID-19 is less severe in younger people and children, on average, in terms of population expected outcome. No guarantees for individuals, but that's what we'd expect as populations. But what's going against it is social conditions, as we've described, crowded conditions, families living together, multiple generations, difficult social, economic conditions. This virus will probably bring social unrest as well. Things like food distribution, growing food production. There could be risks to food security. We have to think of these things now and anticipate. Remember this idea that we have to move from reactivity to proactivity? Well, I was talking about this back in January. So let's get it right this time. Let's be proactive and stop this appalling potential situation from developing. Now, going against things in poorer countries, malnutrition predisposes to infection, HIV predisposes to infection, TB weakens the systems altogether, malaria, yellow fever, all these other existing pathologies, and sexually transmitted infections, also very common in Africa. Now, people do contract sexually transmitted infections in the UK, of course. I've worked in clinics where we treat them. And we get quite a lot of people in, it must be said. But we treat them. We can treat them, mostly with antibiotics and other things. A separate topic. But very often in African situations, they're not treated. And one of the reasons that HIV spread so quickly in the African situation was pre-existing sexually transmitted diseases. Now, there was a special circumstance here because pre-existing sexually transmitted diseases disrupt the integrity of the genital mucosa, the mucous coverings of the genitals, whether it's the glans penis or the vagina or the cervix, or indeed the rectum or the mouth. So sexually transmitted diseases interrupted those mucous membranes, and that meant that the mucous membranes were less able to keep the human immunodeficiency virus out. But as well as that, all these other so that's a bit of a specific situation, but sexually transmitted infections mean the person's already got an infection, and what seems to happen with COVID-19 is if someone already has an infection, the disease is more severe. So quite a few reasons to be concerned there. And as well as that, in a lot of lower income countries, there's a surprising amount of undiagnosed hypertension, which is high blood pressure. There's a lot of undiagnosed diabetes. Now, I've talked about diabetes before. We often associate diabetes with obesity and lack of exercise. But a huge factor, I mean, in Cambodia, about 20% of the patients I worked with in Cambodia were diabetic. 20% of the population is about 20% of the population is diabetic. It's a huge number. No one knows for sure. And it's not because they're overweight and don't work hard. They're certainly not overweight, and they certainly do work hard. Although there is obesity there, but not a lot. But it's probably because they were malnourished in early life that caused the diabetes in later life. So fetal malnutrition and early life malnutrition predisposes to diabetes and hypertension in later life. That's one reason these things are so common. And of course, we know that people with diabetes and people with hypertension get more severe disease. And there's a lot of untreated diabetes and hypertension in many poorer countries. So as well as these sort of traditional infectious diseases, there's these other risk factors as well that will raise the case fatality rate, unfortunately. Now, Imperial go on to make suggestions. Need the rapid adoption of public health measures. Now, this has got to be rapid. Remember, IRC said we haven't got much time here. This needs to be rapid. Testing and isolation of cases, of course. Wider social distancing measures. Rapid isolation. Delays in implementation strategies to suppress transmission will lead to worse outcomes and fewer lives saved. This is not me speaking. This is the best modelers of disease in my country and certainly among the best in the world. Social and economic costs of suppression may be disproportionate in lower income settings. So really, staying at home is a bit of a luxury. I mean, I'm not saying there's not significant financial difficulties in Europe. Of course there are, massive financial difficulties. But most people are eating. But in poorer circumstances, this could result in hunger. It's going to be impossible for a father to stay at home and isolate if he has to watch his children going without food. Of course he's going to go out and try and make money to earn food. This is going to be very difficult. And just an example here of healthcare availability that Imperial give. Lower income countries, there's about 1.2 beds per thousand. Higher income countries, nearer 5 beds per thousand. And of course the quality of services that go with that are much more limited. So I've tried to get through most of that and remain objective. It's difficult. We need a rapid response now, or as I see it, I do hope I'm wrong. But unfortunately I wasn't wrong in January and February, and I don't think I'm wrong now. Without rapid interventions in many parts of the world, millions of people are going to die. I don't think there's any way to wrap that up. So we need an international response. So we need political leaders to get their act together. We need people in charge of the European Union, the United States, to get their act together. And I do think we need some serious global coordination. Now, various countries can help various other countries. Countries can help themselves to some extent, but I also think we need some global leadership here. And let's hope the right woman or man to do that emerges. Or the many women and men emerge to do that. Otherwise, a lot of people are going to die. I'm going to leave that there today because it's... I'm going to leave that there today.